Vascular Surgical Associates started in 1986 when I came here from Emory and joined Fred King. I had finished my training in general and vascular surgery, and he was doing general surgery with vascular, but when I came, we started a practice where we just did vascular surgery. There were 2 of us with 3 employees, and we had 3 small offices, and we were busy, and it was a great opportunity for me. But 4 years later, we added another surgeon, and 4 years after that, we added another surgeon, and then we have continued to grow to now where we have 11 surgeons and about 100 employees and about 10 offices, and we're really busy now. We have been blessed to bring in new doctors who have trained all over the country. Mass General, Pittsburgh, Chicago, Emory, Texas, and these new doctors bring in and help us all be the most progressive group of vascular surgeons around. Patients usually come to us in the office. Sometimes it's in the hospital, but it's in the office, and they're referred for a particular problem usually, whether it be an aneurysm in their stomach or a blockage in their carotid artery or lack of circulation to their legs. And so we treat everything but the heart, essentially. Cardiac surgeons work on the heart. So we treat aneurysms, which are enlargement of the aorta and all the way down into the legs. We do that both with open surgery, and more recently we can put stents in through the groin so the patient can fix a major aneurysm and go home in 1 day, which is amazing compared to what we did when I first came here. We also treat blockages in people's legs. People get hardening of the arteries, PAD it's called, and it will sometimes threaten the leg or make it difficult for the patient to walk. And so we can improve that blood flow by going in and placing stents, which we do in this very room, or sometimes we have to do a bypass. And sometimes it's critical because if we don't do that, they can lose their leg. We also, one of our most common operations is cleaning out blockage in the arteries in the neck. They're called carotid arteries. There's one on each side that carries blood to the brain. And if they get clogged up, which they frequently do, they can cause a stroke. About half the strokes in the United States are caused by blockage in these arteries. So we hopefully can find them before a stroke occurs and go in there and clean the artery out with an operation in the neck. We also take care of patients who have varicose vein problems, and other type of vein problems, which is a very common abnormality. A lot of people have vein problems. We feel like as vascular surgeons who take care of all aspects of vascular disease that we're the best team out there to take care of vein problems as well. So we do these closure procedures or things that can be done for varicose veins. We also treat patients who have blockage in veins from an artery crossing the vein in the abdomen, or we see people who are real athletes who sometimes get a blockage in the vein up here, and we treat those as well. So, and then we treat leg swelling and leg pain and all kind of patients in the ER right now with a clot in the artery to their intestine, which if we don't fix, they will lose their intestine and likely not survive. So we do all of these things. We take care of wounds because many of the foot wounds and things that people come up with are related to lack of circulation to their legs. And so we're involved in that as well. So we're a busy group. When I come in the room, I come in with my MA. I do not have a computer in front of me. My MA is doing that so I can look at the patient, listen to their problems. Frequently family members are with them, and hear what they have to say, because that gives you the best idea of what's really going on. And then once we do sort out what's going on, we review whatever testing that we either need to do or have done, and then we chart out a plan of what they might or might not need. Frequently that's follow-up for some surgery that may need to be done in the future. Sometimes when they get there, it's already clear that they need an operation. But the most important thing to me is to spend enough time with the patient, that they are clear that what we need to do, why it needs to be done. The family understands all of that. They understand the risk, and whatever time it takes to do that is what we take.